Peristalsis is the wave. It's the movement of food, of digestion, from where it comes in to where it goes out. And this digestion can have so many factors that would affect it. To be aware, we would either need to slow it down or to speed it up. This sounds very similar to what we covered, remember, in Unit 4? The actions of drugs: speed up, slow down, destroy and alter, replace and supplement. Slow down, speed up. There you go. All right, so let's talk about these. Anti-diarrheal meds. When you think of these, you're probably thinking of kaopectate, maybe Imodium, maybe Pepto-Bismol, something like that. So when we're talking about anti-diarrheal meds, what really are they? What is the active ingredient? What is it? How is it causing things to get better there? Well, they could be anticholinergic drugs. Remember those? Can't see, can't pee, can't spit. You remember the 4 great I can'ts. Yes, as you recall, the last 4 I can'ts, it's going to slow down peristalsis, okay? It's going to slow down peristalsis. How? By blocking the action of acetylcholine, which is a neurotransmitter. It's slowing down that motion down there. Also, antispasmodics. Now, antispasmodics are also anticholinergic, so they're going to have the same properties. Some are called antispasmodics because of the way they're put together. So antispasmodics are going to help stop spasms in your abdomen, in your colon. So antispasmodic. I'm against. What are you against? Spasms. And in this case, we're talking about the colon. Anticholinergic, antidiarrheal. So these drugs are going to slow things down in there. Let's take a look. All right, here we are. Let's look at some of these. Some of these are to speed up and some are to slow down. This is to slow down, right? Imodium. Now, Imodium, as you might guess, is a very good slowdown. It really is going to slow down that peristalsis, that movement through the colon. Okay? And so what else? What if it works too good? Those of you that have worked in nursing homes, you know how it goes. 2 days in a row, she asked for Imodium, and on the 3rd day, what does she ask for? A laxative, because it worked too well. And then after 2 days of laxative, what does she ask for? An Imodium. So, yes, a side effect of this would be, just always think of it as if, what if it worked too good? Then you would have constipation, of course. What is it used for? It's used to slow down your motility. Slow down, so it's an antidiarrheal med, right? But it is anticholinergic. It does block the effects of acetylcholine. And that is certainly a very popular one. Another one you might see is kaopectate. Okay, and this is going to help with this as well. It's antidiarrheal, but it is not an anticholinergic, by the way. This one, of course, is stronger. The Imodium is stronger than the kaopectate. Okay, so those are a couple of very common ones you'll see. Here you have an anticholinergic, definitely so, and this one is just your antidiarrheal. It works in a different mode than this one does. It's not going to have the same side effects as this one. Okay, now let's come back and talk about speeding things up. Okay, so it's a cathartic. You're trying to get rid of things. You're trying to purge things. There's stimulants, there's fibers, and there's emollients or softeners. Which one do you think would work faster? A stimulant, a fiber, or a softener? A stimulant. It's going to work faster. It stimulates the nerves in the colon to move that along faster. Okay? The fiber is just a bulking agent. It's to help so that the feces are not as hard. Okay. And then the emollient is just going to make it softer, easier for you to go. Not maybe so much faster. This is going to push it through faster. This is a bulking agent which can really help manage a lot of folks' feces by making them not too liquidy but not too hard. And this is going to just kind of soften up the stool and make it easier to pass. So let's look at some of these drugs. Okay, let's take these out of here and let's look at these. Okay, you can see there's a lot of different things in here, isn't this? This is a real problem for many of our elderly, constipation. This is a suppository, and yes, med aides can give suppositories. You're going to expect this to work in maybe 20 minutes, 30 minutes, something like that. It's pretty quick acting. Same with this. This is a enema. Yes, med aides can do enemas. Per the state, maybe where you work, it'll be your policy that you don't, but per the state you can. But you have to go by your policy and procedure of where you work. Yes, so this would be a simple enema, and of course I would expect this to work pretty quickly. So these two are local, right? They're going to work where you put them. Yes. All right. Let's look at some more here. This one is a fiber capsule. So how do you think this would work? Is it a stimulant? No. It's just a fiber. It's going to try and keep the feces in a good, it's not going to be too hard or too soft. It's going to keep it so that it can be passed in a better manner, an easier manner. Aha, milk of mag, remember this? If you take a small amount, it's used for heartburn, excess acid, and if you take more than 15 milliliters, which is half an ounce or more, it's used as a laxative, and it works by the fact that it's magnesium. It's a saline laxative. Okay. Here's one that's extremely common, and the reason I wanted to pick this is so you can see these. This is just senna, and senna is a natural vegetable laxative, extremely common in the nursing homes and hospitals for that matter of fact. And this is just senna. Now this is senna S, okay? So it has something else in it, and be careful. A lot of people have been dinged by state by giving this one when it should be this one, or this one when it should be this one. Really read your label if it's senna S or just straight senna. Because if you read the label on the back here, it'll tell you exactly what is in this. This has ducosate sodium and senna. So this has got an extra ingredient in it that this one does not, so make sure you read this. Now this is ducosate sodium without the senna. This one has both of these in it. This is just the senna, and this is just Dulcolax. Okay, ducosate sodium, which is generic for Dulcolax. This has both of them in there. So you really have to read your order to see which one they're asking for. And of course, that is a stimulant, and so it's going to work faster. All right. There are some new drugs on the market, like Linzess, which is neither of what we're talking about. This is it works in a different manner. This will not be on your test, but I'm showing it to you because you may see this as you're passing meds. Some folks may be on that. Okay, thank you.